The COVID-19 pandemic shook the world, leaving us forever changed. We've learned valuable lessons, but now another threat looms. MPOX, or Monkeypox. Now it's back, and is more dangerous than ever. On August 13, 2024, the Africa Centers for Disease Control and Prevention officially declared MPOX a public health emergency of continental security, while the World Health Organization declared it a public health emergency of international concern on August 14, 2024, due to the increasing severity and spread of the infectious disease's new variant. Many believe we can manage this resurgence given our experience, but what if this becomes the next global pandemic and not just a mere viral infection? What if it's an old enemy with a deadly new twist? MPOX is a viral disease caused by the monkeypox virus. It is classified into two main genetic groups or clades, clade 1 and clade 2. Clade 1 further divides into subclades, 1A and 1B, while clade 2 includes subclades, 2A and 2B. It spreads through direct contact with an infected person, animal, or contaminated objects, such as clothing or bedding. The situation began in 1970 when MPOX was first detected in humans in the Democratic Republic of the Congo, or DRC, and is considered endemic to Central and West Africa. Years later, in July 2022, a multi-country outbreak of MPOX was declared a public health emergency of international concern due to its rapid spread via sexual contact in countries where the virus had not previously been observed. In December 2022, the DRC declared a national MPOX outbreak, leading to the establishment of an incident management system by February 2023 in response to the rising number of cases. Since September 2023, a new outbreak in South Kivu province has rapidly spread within the province and into neighboring North Kivu, primarily driven by sexual transmission. This has been linked to the clade 1 MPOX virus's adaptation to human transmission. This variant is responsible for the first documented case of sustained community transmission of MPOX in the country. Although it remains unclear whether this variant is more transmissible or causes more severe disease than other clade 1 strains, it has complicated diagnostics due to gene deletions. On May 26, 2024, the DRC reported 7,851 MPOX cases and 384 deaths, with a case fatality rate of 4.9%. The virus has spread to 177 of the country's 519 health zones across 22 out of 26 provinces, or 85%. Specifically, the European Center for Disease Prevention and Control reported that the Democratic Republic of the Congo has a total of 16,789 MPOX cases this year, including 14,151 suspected and 2,638 confirmed cases, with 511 deaths, yielding a case fatality rate of 3%. This represents the highest number of cases due to clade 1 in Africa. 5 of the 8 neighboring countries to the DRC have confirmed cases since late July 2024. Burundi, with 61 confirmed and 165 suspected cases. The Central African Republic, with 35 confirmed and 223 suspected cases. The Congo, with 19 confirmed and 150 suspected cases. Rwanda, with 4 confirmed cases, and Uganda, with 2 confirmed cases. MPOX virus, clade 1A, has been isolated from cases in the Central African Republic and Congo, while clade 1B, first detected in the DRC and reported in April 2024, has also been identified in Burundi, Rwanda, Uganda, and Kenya. Additionally, suspected cases are identified in South Sudan. These cases happen because MPOX has multiple modes of transmission, including human-to-human transmission through close contacts, such as sexual and household transmission and zoonotic transmission in certain settings. Observational studies in Kamituga in the South Kivu province in April 2024 indicated that 29% of individuals infected with clade 1B documented involvement in sex work, while 88% of 371 hospitalized patients in the same area reported involvement in transactional sex. Although non-sexual contact, including household and healthcare facility exposure, has also contributed to its spread. Even more concerning, Sweden confirmed its first clade 1b case in a traveler from Central Africa on July 15, 2024, marking the variant's spread beyond the African continent. Now, we are facing multiple outbreaks of different clades with varying modes of transmission across different countries. Additionally, Pakistan's Ministry of National Health Services confirmed at least 2 cases of MPOX, while in the Philippines, a 33-year-old man with no recent travel history was confirmed with MPOX as well. MPOX has significantly outpaced previous strains in terms of spread and severity. Historically, Clade 1 was associated with severe disease and high fatality rates, while Clade 2 was less severe. However, since around 2016, Clade 2 variants have begun spreading more readily between people, showing that the virus has evolved to be more transmissible. The 2022 global outbreak highlighted a new variant, Clade 2b, which, despite having reduced virulence compared to Clade 1, spread rapidly due to its lower fatality rate. The recent emergence of Clade 1b, a new genetic variant of Clade 1, signals ongoing genetic adaptation and an increased potential for transmission. This variant is believed to be more contagious, possibly more infectious, and potentially more lethal. It happens because, as infections mutate, variants tend to develop different characteristics, often resulting in more severe illness. We only know that MPOX typically begins with a rash that evolves into small, raised bumps on the skin, and that individuals may experience fever, headaches, muscle aches, back pain, fatigue, and swollen lymph nodes. But actually, there are still uncertainties with MPOX. For example, before, MPOX lesions typically appeared on the face, chest, palms, and soles. But in the 2022 outbreak, lesions were more commonly found around sensitive regions or inside the mouth and throat, reflecting changes in transmission routes. According to Amira Albert-Roas, a professor of global health and epidemiology at George Mason University, the increased incidence of lesions in the private parts is a significant change from past outbreaks. She notes that it will take time to fully understand these new patterns and their implications. To understand MPOX better, let us take a look at its genetic evolution. MPOX, with its large, brick-shaped particles and extensive DNA genome, evolves more slowly. Compared to viruses with smaller genomes like SARS-CoV-2, its genome is divided into clades, which represent clusters of genetic variants. These clades can further branch into subclades due to mutations and infection rates. Prior to 2022, MPOX was classified into 2 main clades, Clade 1, found primarily in the Congo Basin, and Clade 2, from West Africa. Clade 1 was linked to severe disease, while Clade 2 was less severe. However, by 2016, Clade 2 variants began spreading more easily in Nigeria, indicating increased transmissibility. The 2022 global outbreak, studied through genetic sequencing, revealed rapid person-to-person transmission and the emergence of a new clade, Clade 2b. This new clade appeared to have lower virulence, potentially facilitating its spread. Recent research has identified an additional offshoot from Clade 1, called Clade 1b, indicating ongoing genetic diversity in the virus. With limited vaccines and treatments available, ongoing monitoring and research are crucial to understanding MPOX's evolution and breaking the cycle of transmission before it gets worse. Anne Rimoyne, an epidemiology professor at the University of California, noted that the severity of the disease is influenced not only by the clade, but also by factors such as the route of transmission, the individual's immune system, and the source of infection. Given that there is still uncertainty about how MPOX virus Clade 1 is transmitted, particularly the roles of respiratory droplets, aerosols, and the potential increased risk to healthcare workers, ECDC gave a reminder that it is advisable to follow the precautionary principle when engaging in activities that pose a risk. For general advice, Sham Bishan, head of health and healthcare at the World Economic Forum, states, countries will need to invest significant resources in controlling this outbreak. He emphasizes that while smallpox vaccines and treatments may be effective against MPOX, there is a very limited supply. He also advocates for nations to share key resources and believes that a multi-stakeholder partnership among the private sector, governments, and international organizations is essential to rapidly scale up vaccine and treatment production for MPOX. MPOX spread must be stopped because if this is not immediately addressed, its long-term effects could include potential permanent scarring, both physical and psychological, and, in some cases, internal damage, such as proctitis, leading to ongoing pain or complications. It could also potentially cause lasting vision loss in cases where the eyes are affected, which may result in corneal damage. As of August 2024, the World Health Organization has sounded the alarm on the escalating MPOX outbreak in the Democratic Republic of Congo and surrounding African nations. The situation is so severe that it has been classified as a public health emergency of international concern, the highest level of alert under international health regulations. According to them, the emergence and rapid spread of Clade 1b is alarming because of its heightened severity compared to Clade 2. The situation in the DRC remains critical due to the high incidence of MPOX in endemic areas, geographic expansion to previously unaffected regions, and the emergence of this new strain. Sustained community transmission, limited public awareness, resource constraints, a lack of vaccines, and ongoing insecurity further compound the emergency. In response, WHO is intensifying its support for countries affected by the MPOX outbreak. The organization is actively collaborating with governments and communities to strengthen control measures, curb the virus's spread, and deploy additional experts. WHO is also providing funding for outbreak response and enhancing cross-border collaboration. Support for vaccine rollout includes expediting regulatory approvals and facilitating emergency use listing for MPOX vaccines, which will aid in distributing vaccines to lower-income countries. Efforts include boosting national diagnostic capabilities with testing kits and reagents, conducting genomic sequencing of MPOX strains, and improving disease surveillance and training for frontline health workers. Public awareness campaigns are being intensified to support preventive measures and ensure an effective response to the outbreak. Additionally, WHO has endorsed 2 MPOX vaccines recommended by its Strategic Advisory Group of Experts on Immunization. The organization is working with countries and partners to facilitate vaccine distribution and ensure equitable access. An immediate funding requirement of $15 million has been identified to support surveillance, preparedness, and response activities. WHO has already released $1.45 million from the contingency fund for emergencies and may require additional funding, continuously appealing to donors to support the full extent of the MPOX response. In their declaration, WHO emphasizes the need to scale up surveillance, prevention, and response efforts collaboratively. In the Western Pacific region, the Incident Management System has been activated to improve coordination among headquarters, country offices, and partners. They emphasized that each member state in the region plays a crucial role in containing the spread of the disease, and also mentioned that the government of Japan has demonstrated a steadfast commitment to global solidarity by donating the LC-16 vaccine to countries facing outbreaks and needing protection for at-risk populations. In research aspects, WHO recommends integrating MPOX detection, prevention, care, and research into HIV and sexually transmitted disease prevention programs and other relevant health services. They want to initiate, continue, and support research efforts to generate evidence for effective MPOX prevention and control, aiming to eliminate human-to-human transmission. Their recommended actions include contributing to the global research agenda to swiftly generate and disseminate evidence on the scientific, social, clinical, and public health aspects of MPOX. Furthermore, the Africa Centers for Disease Control and Prevention has declared the ongoing MPOX outbreak a public health emergency of continental security, which allows Africa CDC to mobilize resources, enhance surveillance, and support affected countries. Africa CDC Director General Dr. Jane Kaseya emphasized the urgent need for swift and decisive action, noting that the declaration enables the mobilization of institutions resources, and collective efforts to forge new partnerships, strengthen health systems, educate communities, and deliver essential interventions. He also stated that travel restrictions are not necessary at this time. Additionally, the organization has established a 25-member incident management team at the outbreak's epicenter and has partnered with the European Commission's Health Emergency, Preparedness and Response Authority and Bavarian Nordic to distribute over 215,000 doses of the vaccine. Based on these, the African nations are implementing various measures to control monkeypox outbreaks based on established guidelines. Individuals with suspected or confirmed monkeypox should remain at home, avoid contact with animals, and isolate themselves from others if possible. Pet owners are advised to maintain personal hygiene, avoid contact with infected animals, and use personal protective equipment when caring for pets. For treatment, antivirals such as tecovirimat may be used for severe cases, and mental health support is recommended for isolated patients. People living with HIV should adhere to their treatment and follow the same protective measures as others. Vaccination efforts include recommending post-exposure prophylaxis with vaccines for close contacts of confirmed cases and high-risk groups. Lastly, an interesting point was made by Mark Siegel, an associate professor at the George Washington School of Medicine and Health Sciences, who stated that underlying health conditions in the DRC likely contribute to the higher fatality rate and speculated that with better nutrition and healthcare access, the fatality rate would likely be lower. To effectively address this ongoing MPOX crisis, it is essential to draw insights from past health emergencies. By analyzing the challenges and successes of previous outbreaks, we can uncover critical strategies and best practices that will inform and strengthen our response to the current MPOX threat. This will not only help us avoid past mistakes, but also leverage proven methods to better manage and contain the crisis at hand. The recent declarations by the Africa CDC and WHO of the MPOX outbreak as a public health emergency highlight the urgent need for global action. History has shown the devastating impact of unequal healthcare access, particularly in Africa, where past crises like HIV, Ebola, and COVID-19 revealed how wealthy nations often prioritize their interests, leading to catastrophic outcomes for the continent. The current MPOX outbreak underscores this ongoing inequity. Africa faces a severe vaccine shortage, and we must avoid repeating the mistakes of the COVID-19 pandemic, where hoarding of medical supplies by wealthier nations exacerbated the crisis. Although MPOX is very different from COVID-19, we can still learn from the COVID-19 pandemic, which highlighted the critical need for equitable vaccine distribution. To address the challenge of unequal access to vaccines, the World Economic Forum, in partnership with the Coalition for Epidemic Preparedness Innovations and the U.S. National Academy of Medicine, launched the Distributed Vaccine Manufacturing Collaborative. This initiative aims to create a sustainable global network of vaccine manufacturing facilities, ensuring fair access to vaccines for both pandemic and non-pandemic threats. Moreover, true solidarity requires immediate action. Increased funding for the Africa CDC, equitable access to vaccines and treatments, and support for Africa's vaccine manufacturing efforts. While organizations like Gavi are making progress, more must be done. This crisis also underscores the need for a global pandemic treaty that prioritizes equity and accountability. Only through unified global action can we prevent future health crises from disproportionately affecting vulnerable populations. The MPOX situation is somewhat more manageable compared to COVID-19's initial surge. However, it is spreading in new ways, such as through sexual networks, and has developed mutations whose effects are not yet fully understood. So, to counter these challenges effectively, it is crucial to apply the lessons we learned from past health crises. Firstly, ensuring fair distribution and access to MPOX diagnostics, vaccines, and treatments is essential. This involves addressing supply chain issues and making sure that resources are available to all, especially vulnerable and at-risk populations. Equitable access is critical to controlling the outbreak and preventing further spread. Secondly, providing clear, factual information to the public about MPOX prevention and spread is necessary. Transparent, timely communication helps dispel misinformation and reduce panic, guiding communities in adopting appropriate preventive measures. Thirdly, enhancing testing capabilities and accessibility is another key lesson. Increased testing ensures that cases are identified promptly, which helps in managing and controlling the outbreak more effectively. Fourthly, expanding testing resources and availability is crucial for a robust response. Finally, strengthening public health. The infrastructure is vital. This includes improving workforce support and data management to develop effective, equitable disease control measures. By summarizing and sharing data, public health agencies can make informed decisions that promote health equity and enhance overall disease control efforts. The emergence of MPOX as a potential global health emergency underscores the critical need for a comprehensive and informed response. Understanding the complex dynamics of the virus, including the shift from Clade 1 to Clade 2b, is essential for effective disease management. Lessons learned from past crises, such as the COVID-19 pandemic, emphasize the importance of swift, equitable, and transparent action. Continuous surveillance, research, and adaptation of public health strategies are vital to address evolving challenges and mitigate the risk of future outbreaks. Ultimately, our ability to navigate this crisis and build resilience for future health threats depends on our collective commitment to global health security. Thank you for watching.